Good evening, I'm Mallory Safaste. In Maryland, the number of confirmed cases of COVID-19 continues to rise. Right now, there are 3,609 cases in the state, 484 more since yesterday. 67 people have died from COVID-19 and more than 24,000 people have tested negative. 6 Baltimore City police officers and 2 civilian employees have tested positive for COVID-19, and more than 200 are out on quarantine, including those that work in the Southwest District. That district is temporarily closed since an officer who was assigned there also tested positive. Units from other districts will be used to maintain coverage until the district reopens. 5 more people at nursing homes in Carroll County have died from the coronavirus. 4 at Pleasant View Nursing Home in Mount Airy, the other at Carroll Lutheran Village. The Carroll County Health Department says the victims were a man in his 60s, a man in his 80s, 2 women in their 80s, and a woman in her 90s, all with underlying health conditions. This brings the total number of deaths at Pleasant View Nursing Home to 10. 3 more staff members have tested positive for coronavirus there, bringing the total to 27 staff and 77 residents testing positive. There have also been 5 additional positive cases in residents at Carroll Lutheran Village. Governor Larry Hogan enacted an emergency order to protect residents and staff at Maryland nursing home facilities amid outbreaks of COVID-19. WMAR 2 News' Abby Isaacs explains how they will impact residents and workers.
These directives have to do with expediting testing and expanding personal protective equipment requirements. But the president of the association that represents the majority of the assisted living facilities here in Maryland says some of these orders will be nearly impossible to follow because of the current equipment shortages. Today, Governor Larry Hogan issued the emergency orders to further protect some of the most vulnerable Marylanders. People above age 60 with underlying health conditions are at a higher risk of dying from the virus. Hogan said there are currently cases or clusters of cases at 81 nursing homes and long-term care facilities across the state. Effective immediately, new directives require all nursing home staff who interact with residents to wear protective equipment. He also called for expedited testing through the Maryland State Public Health Lab. The president of the Health Facilities Association of Maryland said while these orders are welcomed, some are going to be hard to follow through with because of the current shortages.
Our state and our country aren't set up to fight a national pandemic like this in terms of workforce, supplies, and testing. And so the reality is that it's going to take all of us to meet these requirements. And we welcome the requirements that the governor issued today. But the requirement on PPE is going to be nearly impossible to meet under the current scenario without state and federal assistance, even when following state and local protocols. And testing continues to be a problem.
Hogan also ordered facilities must designate a unit of staff assigned to the care for known or suspected COVID-19 positive residents. And the facilities must create separate observation and isolation areas for residents, something D'Amato says is already in practice. Hogan said violating these orders would result in a misdemeanor charge that could lead up to a year behind bars and or a $5,000 fine. For WMAR 2 News, I'm Abby Isaacs.